My name's David Geeney. I'm a retired psychiatrist from Oxford, and it's really a great privilege for me to be chairing this session, which proves to be absolutely fascinating. We've got some first-rate speakers for you, and the first of these is Iain McGilchrist, who, as many of you may know, was previously a consultant psychiatrist and clinical director at the Bethlehem and Maudsley Hospital. But before he became a psychiatrist, he had another life in the humanities, because he was 3 times elected a Fellow of All Souls, Oxford, where he taught English literature, and he made the transition from the humanities to medicine and was psychiatry's gain. And I'm sure a number of you are familiar with Iain's magisterial book, The Master and His Emissary, which was published in 2009 to rave reviews for the depth of its scholarship and profound insights into what it means to be human. And so I'm particularly delighted to welcome Iain here today, and he's going to talk to us about the, I think it's the evolutionary aspects of brain laterality. So we look forward to hearing from you, Iain.
Thank you very much. Well, thank you very much indeed, and I do feel it's an honour and a great pleasure to be here and able to talk to your symposium today. I'm talking about something, some work that I haven't written about yet, and so I've broken with my normal habit of speaking off the cuff. I've actually got a text, so part of it will be based on bits out of the few basic points from the thesis of my book, The Master and His Emissary, and later I'll be drawing on material to do with the Corpus callosum that plays a role in my current project, a book entitled There Are No Things, on the philosophical consequences of brain lateralization, which is to be published by Penguin if I ever complete it. Sorry about that. I want to suggest, let me see, how do I do that? Yes. I want to suggest that we can make sense in evolutionary terms of a number of hitherto largely unexplained phenomena. The fact that brains, and not just ours, are divided and asymmetrical, and the nature and the function of the corpus callosum. I also want to suggest that there's a pattern to a very large number of apparently disparate findings relating to lateralization, and that inhibition plays a key role in this unimaginably complex system. That is, of course, at least a book-length project, which is one reason why I wrote one. So today my emphasis will be purely on an evolutionary model of lateralization. Its phenomenological consequences, with which my work has been and continues to be principally concerned, will necessarily remain, I'm afraid, unexplored. Now, the most striking and on the surface puzzling thing about the brain, this organ that exists only to make connections, is its divided nature. Yet it was passed over with hardly a mention, never mind an attempt at explanation, during my medical training. It intrigued Greek physicians as long ago as the 3rd century BC, who thought the right hemisphere was for perception and the left hemisphere for understanding. Arthur Wigan, in 1844, deduced from a series of clinical cases that we must have 2 minds with 2 brains. And the findings of Mark Dax and Paul Broca in relation to the left frontal speech area are, of course, only too well known. Following the first callosotomy procedures of Sperry and Bogan in California back in the 60s, there arose a plethora of theories about the different functions the 2 hemispheres might perform, which broadly distinguished a verbal, rational, analytic left hemisphere from a visuospatially orientated, emotional and holistic right hemisphere, though the evolutionary origin and basis of their separation remained obscure. Subsequent research has, of course, revealed that each hemisphere contributes to language, visuospatial skills, reason, and emotion, indeed, to virtually every cerebral function, suggesting that the bihemispheric structure of the brain is an anomaly. At the same time, the persistence in popular culture of outdated characterizations of hemisphere difference has meant that the topic has somewhat fallen into disrepute, I should say. However, there are not only functional but obvious measurable structural differences between the two hemispheres in humans. Such asymmetries exist at the gross anatomical level, in the size and weight of each hemisphere as a whole and the sulcal gyral patterns on the surface, but also in the size and shape of a number of defined brain areas, the planum temporale being probably the best known, neuronal size, the extent of dendritic branching, length of axons, and the extent of synaptic formation. The ratio of white to grey matter also differs. Neurochemically, the hemispheres differ in their sensitivity to hormones and to pharmacological agents, and there are significant differences in the ratio of dopaminergic to noradrenergic neurotransmission. Added to which, as every clinician knows, when it comes to function, it's not just the site, but the side of a lesion that makes all the difference. So to say that there are no significant differences between the hemispheres is a bit of a non-starter. To quote Tim Crowe, sorry, that's just to show you what a brain looks like. Somewhere there we are. Yes. To quote Tim Crowe, except in the light of lateralization, nothing in human psychology or psychiatry makes any sense. And Onno Gunturkun, who won Germany's most prestigious science prize, the Leibniz Prize, for his work on lateralization in birds, comments, hemispheric asymmetries pervade practically all major neural systems of the human brain. There is hardly any perceptual, cognitive, or motor system that is not affected by left-right differences of at least some of its components. And I would add also, not just perceptual, cognitive, or motor, but emotional and social. Why should that be the case? And the corpus callosum, the main body of fibers connecting the two hemispheres. I'm going to come back to the corpus callosum later, but for now let's just notice three things. The first is that most creatures don't have one. Though any creature big enough to have a recognizable brain has a divided brain, fish, birds, reptiles, amphibians, monotremes, marsupials, only mammals have a corpus callosum. The rest get on with relatively exiguous commissures. The second is that the relative size of the corpus callosum has reduced with mammalian evolution, and that much, perhaps the majority, of callosal function in humans is ultimately inhibitory. And the third is just how normal split-brain patients turned out to be, barring some colourful instances of intermanual conflict in the first weeks or months after callosotomy. In daily life, normal services were resumed astonishingly quickly and completely. It seems the hemispheres are not only separate and asymmetrical, but happy to keep it that way. Structural and functional asymmetry of the brain is not only pervasive in humans, and it has an ancient lineage. Indeed, it goes back, that's not a brain scan, it goes back to the most primitive nervous system of which we have knowledge, that of Nematostella vectensis, a still extant sea anemone, which is over 700 million years old and living off the Isle of Wight. It already, like a lot of people in the Isle of Wight, it already exhibits lateral asymmetry. Two signal paths, WNT and BNP, that are instrumental in the centralization of nerve cells in vertebrates run at right angles to one another, thereby creating an asymmetrical pattern of neuronal cell types. According to Thomas Holstein, whose team carried out the research, it is the birthplace of centralization of the neural network that is to become the complex brain of vertebrates. Asymmetries of behavior can be traced back more than 500 million years. Fossilized trilobites have a 3-to-1 distribution of right to left bite marks at their rear, perhaps suggesting they were more alert to potential attacks on their left side. The nematode C. elegans, which evolved about 600 million years ago, and which has a nervous system of just 302 neurons, expresses chemoreceptors with left-right differences. The slug Limax memorizes food odors asymmetrically in its procerebral brain divisions. Honeybees also show left-right asymmetries in sensory processing behavior and neural representation. as Gunturkun puts it, if animals from nematodes to humans show asymmetries of brain and behavior, we should expect that left-right differences provide some important fitness benefits. What are those benefits? I suspect the answer is that laterality has served several functions over evolutionary history. But there's no doubt that one critically important and enduring one concerns the need to pay divided attention to the world. In Darwinian terms, there is a need to be able to feed and keep a lookout for predators at one and the same time. This requires the bringing to bear of diametrically opposed types of attention to the world simultaneously. One, narrow beam, sharply focused, fragmentary, already committed to its object. The other, broad, open, sustained, vigilant, and uncommitted as to what it might find. This is a difficult feat. The solution adopted by all known animals is a divided brain, in which the two halves remain sufficiently distinct to function independently, but sufficiently connected to function in concert. This is also, unsurprisingly, the case in humans, where the evidence is that the left hemisphere tends to yield narrow, fragmentary attention, and the right hemisphere broad, sustained attention. Lateralization brings evolutionary advantages, particularly in carrying out dual attention tasks. This can readily be seen in chicks, those that have been experimentally deprived of exposure to light on the 19th day of incubation do not lateralize normally and cannot so effectively combine feeding and predator detection. Marmosets with more strongly lateralized brains are better able to both forage and remain aware of predators. Lizards that use only their right hemisphere in exploring a new environment react faster and more efficiently than those using only the left hemisphere. The same more successful individuals that use the right hemisphere for exploration and watching out for predators also use the left hemisphere for tracking prey. Even if the appropriate eye for the task is taped over, they will try to use it in preference to the uncovered but inappropriate eye. Extraordinary finding. In more general terms, separation leads to specialization, which also brings advantages. In fact, as Gunther concisely says, asymmetry pays. Pigeons with stronger visual asymmetry are more successful when foraging for grain scattered among pebbles. There are shorter reaction times in cats that have a lateralized paw preference. Lateralized chimps are more efficient at fishing for termites. Similarly, human individuals with pronounced language lateralization have higher verbal IQs, better reading skills, and better language receptivity. Indeed, there's evidence suggesting that individual human brains that are, for one reason or another, less lateralized than the norm show global deficits. The left hemisphere providing detached, narrow beam, highly focused attention is thus better suited to instrumental purposes, while the right hemisphere providing broader, more sustained, uncommitted attention to the rest of the world makes it better at seeing and understanding the whole. The right hemisphere is deeply involved in social functioning, not just in primates, where it's specialized in the expression of social feelings, but in lower animals and birds as well. For example, chicks preferentially use the left eye for differentiating family members of the species from one another and from those who are not familiar, and in general for gathering social information. Many kinds of birds have been observed to approach their parents or direct courtship displays to conspecifics seen with the left eye, that's the right hemisphere, and to peck more successfully at prey using the right eye, left hemisphere. Similarly, in animals, toads, for example, attend to their prey with the left hemisphere, but interact with their fellow toads using the right hemisphere. The right hemisphere is the main locus of early social experience in most mammals. And just this week, a study has shown that flying foxes and walruses, not to mention whales and humans, much prefer to protect and suckle their young on the left side. Well, the human bit's been known for a very, very long time. Asymmetries are grossly increased in humans. One interesting asymmetry concerns the posterior expansion of the left hemisphere, which is on the right in your drawing there. looking at the base of the brain. This was said to be to do with the acquisition of language, which, being a complex function, required to be located under one roof, and took up residence, almost at random, in the left hemisphere, which obligingly expanded to accommodate it in the language area. None of this can be true for a number of reasons. For instance, we now know that language functions are distributed across both hemispheres, so cramming all into one is hardly an adequate explanation. And in any case, the same expansion was present in the brain of pre-linguistic man, as it is present in the brains of all the great apes, who nonetheless have no language. Besides which, it does nothing to account for a lesser-known expansion, which you can see at the top of the picture, that of the right frontal cortex, which is nonetheless the single largest asymmetry in the brain, again not mentioned in medical school, and the most recently evolved, giving rise to so-called Yakovlevian talk, this view that the brain looks as though it's been given a twist. It would seem that the main distinction is not between what each hemisphere does, since each is involved in everything we do, but in how it does it, by which I don't mean the mechanism involved, but the manner in which whatever it may be is approached, the take on it, if you like. Not the what, but the how. It's not controversial among neurologists that the two hemispheres pay different kinds of attention to the world. It's also not controversial among psychologists and philosophers that the nature of attention you pay determines what it is you find in the world. It therefore follows that the two hemispheres must bring into being two kinds of experiential world. The evidence that this is the case is both widespread and profound, and forms the subject of my long book, The Master and His Emissary. What are these worlds like? Well, clearly it lies well outside the scope of today's talk to explore the ramifications in any detail, but in effect the consequences are far-reaching. In brief, the world as experienced by the left hemisphere consists of isolated parts or facts that have to be assembled by us, parts which are in themselves relatively fixed, certain, known and familiar, abstracted from context, explicit, general, and lacking in life. A lot is left out of this picture, but its value is as a representation, that is to say, something that is no longer present to us, and its simpler nature makes it more useful, just as a map is a more effective guide to the terrain it maps by leaving much out. The world as experienced by the right hemisphere is by contrast constantly presencing to us, as Heidegger would put it, one in which newness and uniqueness are more evident than generalized familiarity, one of possibility rather than certainty, where there are not fixed parts, but flowing, changing, interconnected wholes, where all lies implicit in the context in which it inheres and is embodied. In other words, an animate world, and also the world described by contemporary physics, by the way. This has consequences for the way we see everything, from music to morality, reason, emotion, the body, time, space, the world, and the self. I shall have to leave all that unexplored today. Now to the callosum. Sir Charles Sherrington described living systems as requiring what he termed opponent processes, whose very opposition makes possible finely calibrated responses to the environment. Simple examples would be flexor and extensor muscle groups, or the sympathetic and parasympathetic nervous systems. As has been often noted, there is not just one, but three such opponent processor systems in the brain, one for each main axis. The vertical axis, the relationship between subcortical regions and the cortex, the rostral caudal axis between the frontal cortex and the posterior cortex of the same hemisphere, and the lateral axis, that of the two hemispheres. Each one of them involves a relationship of balance that includes both mutual potentiation and mutual inhibition. To understand the relationship between the human brain hemispheres and the corpus callosum, particularly as it's embodied there, involves looking at each of these axes as they impinge in turn on one another in the development of the mammalian and ultimately the human brain. The first mammals appeared in the late Triassic and Jurassic period about 200 million years ago. They were small creatures at first, mouse or shrew-like, probably nocturnal, living low to the ground, possibly subterranean. The first mammalian development was in the vertical axis, that of the neocortex, a mammalian invention. This doubled the number of cortical layers from just 3 in reptilian allocortex to 6. Since, broadly speaking, the power of the brain increases with the number of cell layers, the development of the neocortex with the first mammals is a radical shift in brain capacity. What drove it? One likely hypothesis is that to survive in their various ecological niches, these small animals had to be smarter than the lumbering creatures alongside whom they lived and whom they eventually replaced, and they needed sharper senses and proportionately bigger brains. Their tetrapod ancestors had a relatively low-resolution sense of smell, poorer vision and hearing, coarser tactile sensitivity, and unrefined motor coordination, with little of the cortex devoted to sensory-motor integration. The first mammals then needed 2 things above all: more sophisticated sensory information and better integrated topographical maps. Similarly, they were initially 2 sensory modalities of supreme importance to them, olfactory and tactile, both being especially important to nocturnal creatures living close to the ground. Developing fur coats, of course, conserved heat in small animals, especially vulnerable to heat loss, that's what we know, but it also provided an extraordinary sophistication in tactile spatial awareness. The neocortex is dominated by a single primary somatosensory field. Sorry, that's not really relevant at this point. The neocortex is dominated by a single primary somatosensory field, mapping sensation from the greatly expanded olfactory bulbs, the skin, hair follicles, muscles, and joints. In reptiles, the equivalent sensory mapping is carried out in the mesencephalon, beneath conscious access and at a level where there is a well-developed cross-midline connection, the tectal commissure. However, the projections from there to the more consciously accessible reptilian telencephalon lose their topographic organization, i.e., they are no longer at that level a map. The development in mammals of a high-level map across the whole perceptual field is a crucially important step in the capacity for complex awareness of the world and the ability to make quick, subtle, and accurate responses to it. Above all, it delivered the potential to integrate information, a process that could not be achieved across the relatively sparse connecting fibers of the upper levels of the reptilian brain. Clearly, what mammals needed was a superhighway connecting the 2 cortices, a demand that became more pressing as auditory and visual processing, as well as bimanual coordination, became more prominent over time. This is, of course, where the corpus callosum comes in. But before we leave the vertical axis, notice that at its origins, the neocortex began in the service of enhancement of already existing cortical functions. Later, it would come to be both a facilitatory partner and an inhibitory one, an opponent processor, exerting a downward inhibitory effect on the reptilian brain. So to the lateral axis, that of the corpus callosum. Non-mammals, as I say, have no callosum, instead having substantial anterior and posterior commissures, which in most mammals have now become fairly exiguous relics. But even these larger commissures are very slim by comparison with the corpus callosum. I should note here that the callosum is often misunderstood not only as a unifying force, which it clearly often isn't, but also as the only means of communication between hemispheres, which it never is. The anterior commissure in humans, although very much smaller, about a 50th to a 100th of the size, does transfer some information between hemispheres, and to an even smaller extent, the slender posterior commissure does too, though it's mainly concerned with pupillary reflexes. And they share the influences of hormones through the blood supply and of cerebral peptides through the CSF, both of which, though slower acting, are as important as neuronal communication for regulating mental states. What's more, every single motor act initiated in one hemisphere gives thereby proprioceptive and visual feedback to the other hemisphere. So even without the corpus callosum, the two hemispheres are not completely isolated. However, the callosum remains by far the most immediate way in which the two hemispheres of the human brain interact, and it's the mediator not merely of connection, but of hemisphere specialization, as I will suggest. It's thought that the callosum came into being in order to enable gaze pursuit across the midline for fast-moving objects and to reinforce, more generally, perception in all modalities around the midline of the attentional field. How do you communicate faster? Well, one way, of course, is to take shorter routes. Nerve fibers that had to route forward and then back needed to take a more direct central route. The other is to speed transmission. With respect to the first, the shorter route, the initially slender hippocampal commissure began to route more and more into hemispheric fibers and eventually developed into the corpus callosum. But there is a snag. Remember, mammals have proportionately much bigger brains than other animals, and that means both more information to be sent and yet at the same time longer distances over which to send it. Moreover, if brains were to remain proportionately interconnected as the number of neurons grew, the number of neuronal connections of all kinds would have to grow geometrically, not arithmetically. This is not only impossible because of the external constraint of head size, but is self-defeating because of increasing conduction delays. You can attempt to address that by increasing fiber thickness, which speeds transmission, but the fibers then take up more room, not just in the corpus callosum, of course, but throughout the brain. Moreover, you can myelinate these thicker fibers, but that makes them thicker still. As the brain grows then, and with it the complexity of its tasks, there has to be a trade-off. There comes a point where interconnection must be limited. Possibly the only viable solution, and it is the one nature has taken, is specialization. More specialized hemispheres communicate only on a need-to-know basis. As you can see, once begun, this is a self-reinforcing process. More specialized units need to communicate less, and with less communication, they become more specialized. And this in turn has an effect on the corpus callosum. It becomes neither more nor less important, but it has to change its function. What this means is that the callosum, like the rest of the brain, needs to differentiate and itself specialize. Conduction times short enough to support joint activity in both hemispheres are possible only in a few instances, not in all. So it is we find that only a small population of large diameter fibers continue to increase their diameter in species with larger brains. These are the essential sensory motor tracts that enable coordination across the midline of the attentional field, which was the earliest pressure, after all, for the evolution of the callosum. Indeed, of all sensory input, integration of auditory and visual modalities is the most highly conserved, with high-resolution processing of central vision, making possible accurate depth perception, and binaural cells generating a cortical sound localization system, a sort of sense-around experience. For the rest, most areas do not require the same urgent coordination. The callosal fiber types are arranged with the larger diameter, swifter communicating axons connecting visual, motor, and sensory motor cortex, and small or smaller diameter, weakly myelinated, slower communicating axons connecting the higher order processing areas involving more sophisticated cognitive functions. I think you can decode what the letters there stand for. The frontal, that's motor, sensory, and so forth, back to the visual cortex. For here's the point. Given specialization and differentiation, one thing callosal tracts need to ensure is a sufficient degree of non-interference, and that means inhibition, a balance between imparting information at the sensory motor level and inhibiting premature involvement at the cognitive level needs to be struck. The human corpus callosum contains an estimated 300 to 800 million fibres connecting topologically similar areas in either hemisphere. Yet only 2% of cortical neurons are connected by this tract. What is more, the main purpose of a large number of these connections is to stop the other hemisphere interfering. Although the majority of cells projecting to the corpus callosum use the facilitatory neurotransmitter glutamate and are excitatory, many of them terminate on GABAergic intermediary neurons or interneurons whose function is inhibitory. As activation builds in one hemisphere, the homologous region in the other hemisphere is inhibited. Initial excitatory response is followed by a more prolonged refractory inhibition, and these effects can be seen on imaging. Intriguingly, the cortex of primates has many more and a greater variety of types of GABA neurons, reflecting greater sophistications of inhibitory functioning than the cortex of any other mammalian order. In fact, inhibitory interneurons constitute about 25 to 30% of the entire neuronal population in the cortex of primates. And within primates, the largest and the most numerous such interneurons are found in humans. Inhibitory interneurons are critical to normal functioning across a whole range of activities in the human cerebral cortex. Indeed, the great neuropathologist Ramon y Cajal believed that the extraordinary power of the human mind was primarily dependent on the increase in the number and diversity of cortical inhibitory interneurons, many of which he was the first to identify, the power of opposites, opponent processes once again. The neural basis of schizophrenia and autism is likely to involve a complex of interrelated factors, but a finding common to both conditions is smaller callosal cross-sections. Equally, callosal agenesis is often associated with a picture resembling autism. A balance has to be struck between the facilitation and inhibition, and the problem here would appear not to be that there's not enough mutual involvement of the hemispheres, but not enough interhemispheric inhibition. There's also a possibility that GABAergic interneurons are dysfunctional in schizophrenia, as you probably know, with a similar impact on inhibitions. In any case, in the normal brain, by inhibiting the overall activity in one hemisphere, the corpus callosum may allow the other to take over for tasks more suited to its mode and thus maintain independence of the two hemispheres. Hence it is that the corpus callosum arises relatively late in evolution, but cannot keep pace with the growth in brain size and becomes actually smaller in proportion to the volume of the brain as a whole as evolution progresses. The proportion of callosal fibers gets smaller, both as the brain gets bigger and as it becomes more asymmetrical, which is presumably in itself a marker of specialization. In fact, as a general rule, the higher the species on the phylogenetic scale, or the more mature the individual organism, the more restricted the commissural connections of all kinds. And specifically in humans, there's a marked decrease in the rate of growth of the corpus callosum when compared with the intra-hemispheric white matter tracts, such as the superior longitudinal fasciculus and the uncinate fasciculus, the long tracts that help draw together processes within each hemisphere. The corpus callosum itself comes to embody the predicament of the entire cortex and ultimately of the human world, how to hold things together and yet keep them apart. Now let us turn to the remaining axis, and with it to the function of the frontal lobes. Of course, one of the differences between great ape brains, including human brains, and those of most other mammals is the expansion of the frontal lobes. In an intelligent animal such as the dog, they account for about 18% of the brain. In monkeys, about 30%. In the great apes, about 35%, and in humans, about 37% of the entire brain. And what is the frontal cortex for? Largely for stopping things happening. Its function is inhibition. It is, in fact, the opponent processor par excellence. It enables standing back from the immediacy of experience to take the broader view, contextualize, test hypotheses, and plan for the future. Thus, if the relationship of the frontal and posterior cortex is antagonistic, yet it is in pursuit of the same goals. Negation is, once again, not by any means merely negative, but enables something new to come into being, much as we don't make a statue by putting things together, but by clearing things out of the way. Standing back in the interests of distancing from experience makes possible the running of virtual worlds, testing possible scenarios in the interest of either understanding the world, right hemisphere, or manipulating it, left hemisphere, better. With the advent of language, especially, being able to go offline creates a relatively abstracted and virtual world alongside the immediate world of perceptual experience. And clearly they have to be kept apart if each is to work efficiently. What is becoming increasingly apparent to me is that the left hemisphere is no longer primarily concerned with reality, more with theoretical constructs. What evidence suggests that the left hemisphere is less veridical? There's a mass of this, I'm going to have to cut it short. There is perceptual superiority in the right hemisphere compared with the left in every aspect of every modality studied. That this is evolutionary can be seen from the fact that in the pre-human cerebral cortex, the left hemisphere is less conceptual, more perceptual. Visuospatial skills are less lateralized, with more remaining in the left hemisphere than is the case in humans, where that territory has been colonized by abstraction. Contrary to myth, the right hemisphere is better at reality testing than the left hemisphere, draws more reliable conclusions, is less prone to jump to conclusions, more measured and judicious, and is less subject to bias, as a vast and increasing body of evidence shows. What I like about the quote from Nicky Marincek is that it comes from Gazzaniga's laboratory, and Gazzaniga was the man who 30, 40 years ago said the right hemisphere has about the intelligence of the average chimpanzee. But he's now had to swallow the fact that it is literally more intelligent in that you get more damage to the IQ by damage to the right hemisphere than the left. Brilliant research, 2014, showing this very clearly in a series of 128 patients. But it is also much more reliable and much better guide to just about everything in human experience. It's largely responsible for our capacity for theory of mind, whereby we come to understand human situations. Misperceptions of space, distortions, shrinking, expanding or flattening, and of time, its breaking up into static frames or changing speed drastically, are much commoner after right hemisphere damage. In fact, right hemisphere damage leads to loss of depth in space, time, and emotion. Distortions of reality, both in terms of delusions and hallucinations, are approximately 3 times commoner and more extreme and intractable when they occur after damage to the right hemisphere. Particular organic syndromes, including delusional, these are always after identifiable cerebral lesions, so we can see where the lateralization is. Including delusional paranoia, the familiar and bizarre syndrome of hemi-neglect, anosodiaphoria, an emotionally inappropriate disregard of a deficit, anosognosia, the denial of a deficit, asomatognosia, failure to recognize the existence of a body part or a body half, somatoparaphrenia, believing a body part has been substituted by an alien object, prosopagnosia, inability to recognize faces, delusional misidentification, such as Capgras syndrome, in which someone or something familiar to you has been substituted, or its obverse Frege syndrome, the mirrored self-delusion, failing to see or to recognize one's own face in a mirror, Cotard's delusion, believing you're dead, delusions of infestation, sorry, I moved on one there, Alice in Wonderland syndrome, in which there are distortions of body shape and size and also in space and time, delusions of infestation, obviously left that one out, phantom limbs, that's to say not after having one amputated, but actually experiencing a phantom extra limb, or up to 6 or 7 in some cases extra limbs following a stroke. Misoplegia, taking a an irrational hatred of a purportedly malfunctioning limb, and xenomelia, desire to have a healthy limb amputated, are all either almost exclusively or very much more commonly found after right hemisphere damage. The Othello delusion, morbid jealousy, and de Clerambault's syndrome, erotomania, are somewhat commoner after right hemisphere damage, and in fact Martin Brunner reported with a colleague a couple of cases. One had right hemisphere damage, the other one had I think an infarct in the left internal capsule, but he's here and can correct me. Heotoscopy, confronting a copy of yourself at a distance, shows no particular bias one way or the other. And apart, of course, from the very significant semantic and syntactical deficit syndromes, which principally follow left hemisphere damage and are its common manifestations, only autotopagnosia, inability to name and identify correctly body parts, is clearly commoner after left hemisphere damage. In other words, here is further evidence, if needed, that our understanding of the experienced world itself, rather than our capacity to discourse about it, depends very heavily indeed on the right hemisphere. A further illustration comes from an extraordinary and elegant piece of research by Marcel Kinsborn and a Russian colleague, Vadim Deglin. Temporarily suppressing one hemisphere at a time gave them a window just for about 15 minutes into each hemisphere's world. Thus, they were able to ask the two halves of one and the same individual's brain the same questions and compare the answers. And what they asked was simply whether each of 5 syllogisms was true. A syllogism, I would remind you, is a logical structure whereby 2 propositions or premises taken together lead inevitably to a conclusion. The classic example is all men are mortal, Socrates is a man, therefore Socrates is mortal. In the experimental examples, however, there was a twist. In each syllogism, one of the premises was false. So was the conclusion true or not? Here's an example. All monkeys climb trees. So far, so good. The porcupine is a monkey. Not so good. Does the porcupine climb trees or not? As you can see, the question's not quite straightforward. Between you and me, there are annoyingly porcupines that climb trees. So before someone points it out, I should say that this fact was clearly not known to the Russian investigators or their subjects. And for present purposes, we can put that out of our minds. The experiment was carried out using the same 5 test syllogisms on 10 different subjects, each 3 times over, first in the normal state, and then with just one hemisphere functioning at a time, yielding 150 results overall. The intact individual says the conclusion is untrue. It's not true, the porcupine's not a monkey. When the right hemisphere alone is asked, it replies with some indignation that the porcupine is not a monkey. It's prickly like a hedgehog. It's wrong here. However, when the isolated left hemisphere of the very same individual, this is not just aggregated data, the one that's previously given the indignant response, is asked if the conclusion is true, it replies that, yes, the porcupine climbs trees, since it is a monkey. When asked by the examiner, but is the porcupine a monkey, the subject replies that she knows it's not. Nonetheless, when asked again, she repeats that since the porcupine is a monkey, then it climbs trees. Again challenged by the examiner, but you do know that a porcupine is not a monkey. She insists on her answer. Why? Because that's what's written on this piece of paper. The results were consistent across the 10 subjects. In fact, one subject answered all the questions empirically by reference to real-world knowledge when in the normal state, as well as when using only her right hemisphere, and answered them all formally according to the internal logic of the system when using only her left hemisphere. Before I close, I want to just revisit quickly the phenomenon of Yakovlevian talk. I explained that conventional explanations in terms of language couldn't account for the left posterior expansion. But language bridges the gap between abstraction and experience. The abstract procedural elements of language, it's true, most of the lexicon and the grammar rulebook, the sort of things a computer can do reside in the left hemisphere, but all its embodied real-world aspects, implicit meaning, tone of voice, pragmatics, the understanding of an utterance as a whole in a real-world context, irony and things like that, depend on the right hemisphere. Once again, the problem is in thinking of the distinction as lying in a so-called function, such as language, rather than seeing it in a whole disposition towards or way of being in the world that cuts across such categories. Yakovlevian talk expands in apes pari passu with the development of the frontal lobes. That should make us think. If the frontal cortex helps us stand back from the immediacy of experience, this serves the overall raison d'etre of each hemisphere in its own way. In the left, more effectively to manipulate the world, and in the right, to understand better the world with which we stand in close relation. The left posterior expansion is present in apes because they, like us, have learnt to abstract and conceptualize, even though they don't have language. And the right frontal expansion? It's present in apes because they, like us, are deeply social animals. That is what this largest and latest expansion of the brain, the right frontal cortex, of course in balance with the right posterior cortex, principally subserves. Empathy, bonding, theory of mind, metaphor, jokes, irony, the musical aspects of language, flexibility, tolerance, and moral sensibility. To sum up, I have suggested that asymmetries of the nervous system are ancient and universal and have their roots in a need to pay differing kinds of attention to the world at the same time, most obviously detached piecemeal attention to detail, subserved by the left hemisphere in the interests of better manipulation, and exploratory sustained attention to the whole field with a view to better understanding, subserved by the right. I mentioned in passing that this has predictable effects on the way in which the two hemispheres differently approach every aspect of experience, that the difference between the hemispheres is not that they deal with different so-called functions, but that they both deal with all such functions, just in a predictably and reliably different way. Over time, the hemispheres have become necessarily more specialized for reasons that can be understood in evolutionary terms. And for such reasons, the left hemisphere has become a largely virtual realm. The fact that our thinking as a society seems grossly skewed towards the take on the world promoted by the left hemisphere is worrying, but again, that is not my topic for today. Thank you very much.
Thanks very much, Iain. There's a lot of food for thought there, and I wonder if I could kick off thinking about the evolution of man, the cognitive revolution, as it's sometimes been called, around 70,000 years ago, when suddenly all the artifacts of culture started to become evident. It's a bit of a puzzle, as I understand it. What happened to the brain at that time when all the things that we think make us characteristically human suddenly started appearing? And I wonder if you had any insights into what led to this onset of cultural evolution from that point.
I have no good reason to espouse any particular theory. It's an area for anthropologists, and the anthropologists don't have an explanation that I'm aware of. There are various theories to do with the wiping out of certain hominid types by others who came in from other areas of the world, but I mean, we don't know. And I haven't got an answer.
No, it just sounds as though the brain had developed a new capacity, the capacity for fictive language, for ideology that came in at that stage, and whether we have any insights into what may be going on.
Well, one possible thing is that development of abstract ways of thinking and indeed language is much more necessary when you have larger groups of people living together. When you have small groups, the sort of I-thou relationship is good enough. And I suggest in The Master and His Emissary that language as we now know it, emerged from what Meithen calls musi-language, and because of the need in larger social groups to refer to things and people, individuals that weren't present. And that conceptualizing may lie behind that burst forward, may have been precipitated by larger social groups. I mean, that's one possibility. I'm just putting it forward.
Right. Thank you. Riyad?
Yes, just to...
do you have a
do I need
microphone?
Yeah.
Go for it.
I need to turn it on? Yeah. Thank you very much for a fascinating talk. Just to maybe paraphrase or give you the same question but in a different way that David has put to you, there's been a lot of interest recently in the neuroscience of religion and the evolution of religion. And it just so happens that that religions seem to have arisen or dominated the life of Homo sapiens around the same time as the flourishing, the cultural flourishing that David has referred to, which is somewhere around 70 to 80,000 years ago. And I was just wondering, in your laterality scheme of the brain, do you have a view on the evolution of religion or the issue of spirituality and so forth? That seems to be a characteristic of our species.
Well, yes. I mean, first of all, we only think that, as it were, there was this arising of religion around that time because it's a sort of circular argument, because that's where we've got the evidence of it, if you know what I mean. We don't really know what was going on for 500,000 years in the brains of Neanderthal men who had larger brains than we do, and who lived peacefully in social groups for long periods without destroying the planet. So we don't know quite how they thought or what was going on there. I take the possibly unfashionable view that religion is not just a cultural construct, though the ways in which it manifests are culturally constructed. So I would say that it's only a kind of rather reduced picture of the world which we've espoused just for the last couple of hundred years since the Enlightenment. We're the only culture ever to have done so, and only for a very small part of our history we take it that this must be an advance. It may or it may not be. I mean, we could be here all day debating that. But I don't take the view that somehow a God node suddenly evolved in the brain, if you like. No. I mean, lateralization of the brain is a whole other topic, because there is evidence about that.
Can I just come back just for... I mean, I wasn't just reducing religion down to a set of beliefs or whatever, but I mean, there is a whole array of, if you like, capacities that humans evolved around that time, it seems. Yes. I mean, again, we don't know exactly how or what evolved, but the capacity for synchrony, for instance. Yeah. Humans have this unique capacity to synchronize with other humans. Yes. And this is a key aspect of religiosity. True. Because ritual is, by definition, a group activity. And it seems that, although I think there is some evidence that apes can synchronize to an extent, and there have been certain observations, I think, by primatologists that chimpanzees can engage in certain ritualistic behavior as a group, but not to the extent, extent that humans do. Yes. So, I mean, I wasn't, just to clarify, I wasn't just reducing religion down to a set of belief, but a whole array of capacities.
Yes, and you know, although there is a very nice YouTube of a cockatoo called Snowball who is dancing to a beat, probably it's more or less humans that have this capacity for rhythmical entrainment. And as far as I know, it's only humans that can synchronize their vocalizations to make sounds together. And you're right, these are very powerful things. Oliver Sacks writes about the idea that in religious ceremonies, in fact, and I wish he were alive to ask him quite in more detail what exactly he means by that, but that there is sort of entrainment of nervous systems together.
Well, questions? There's one over there.
Is that right?
Yes.
Self, the nature of the self, can preoccupy psychiatrists a lot. And
what do nature?
Self.
The self.
Nature of
Yes.
self processes.
Yes.
And I kind of wanted to ask something based on James's distinction between the I and the me, and whether you feel that's reflected in your hypotheses about lateralization. And just to connect it up with what you were saying at the end about inhibitory processes going from the frontal lobes backwards, and are those sort of self-creating processes?
Well, I mean, to take the second one first, I mean, I take it that any massively complex system, such as the nervous system, is a sort of self-evolving, self-perpetuating, responsive system. Trying to say this particular thing just led to that is probably too simple. But I mean, about the self, yes, I mean, I do, it's a big issue, a big question, isn't it? Because we mean so many different things by the self. But in The Master and His Hemisphere, I do make a distinction between, which is something quite like what the distinction that William James was making between what the right hemisphere subserves and what the left hemisphere subserves. But it's a big area, and I think the problem is that people often don't clarify sufficiently what it is they're talking about when they talk about the self.
Over here.
Thank you for your presentation. I was wondering when Dr. Abdi spoke about the empathy and development of empathy, if you think that the mirror neuron system could have a place in that kind of development of the human brain. Because it has been proven that, or at least the hypothesis has been advanced, that great apes, monkeys, can actually react to stimuli, even though they, just if the stimuli is proposed, but not if it is presented.
Yeah.
Food and so on. And if somebody else eats that food or...
Yes. I mean, I think the point is, well, could mirror neurons form an important part of this story about empathy growing? Is that it? Yes. Well, I mean, I think you all know that, after Laterality, there was an enormous excitement about mirror neurons, which was somewhat sort of stocks in mirror neurons have sort of tailed off a little bit lately, like Bitcoin. I mean, certainly there are these systems or neuronal nodes, but the brain, particularly the right hemisphere, very much is constantly, in all aspects, as it were, responding to, inhabiting the worlds of others. Dossetti and Chaminade in France, who've done a lot of imaging of this, say, when you feel pain, it's in both your hemispheres. When you feel my pain, it's in your right hemisphere, and so forth. So, I mean, we're thinking less in terms, aren't we, of small areas of activation and much more in large networks. And, it may seem to some people a bit gross to talk about hemispheres as a whole, but they're massively interconnected within one another. And the superior longitudinal fasciculars and the uncinate fasciculars are of vital importance in drawing together neuronal activity within a hemisphere by an order of magnitude, 10 times as much as any cross talk between the hemispheres. So they are very, very self-involved systems, and each is capable of sustaining consciousness on its own. So I think rather than, in short, I mean, I'm sure you're absolutely right. Of course, mirror neurons are there, they're exciting, they play a part, but it's not the whole story, as I understand it.
One more question over there.
The people who may have done their GP training may remember a book by Roger Neighbour, and it had a picture of a doctor with two heads, and it was entitled The Inner Consultation, and the idea was you were constantly self-monitoring. So is that a function of laterality, that we're able to do this whilst acting, we're also monitoring and constantly revising what we're acting, what we're doing?
I don't think it's primarily a function of lateralization, no. But I mean, I think it involves activity in both hemispheres. It's probably more to do with the frontal lobes of both hemispheres enabling us to stand back from our own experience and, as it were, take a view on it. So that would be my guess. Thank you.
Okay, one final question, Professor Tracy. Go for it.
Do you think that there is any connection between lateralization and the extreme male brain hypothesis of Baron Cohen and extreme female brain by Crespi?
Well, thank you for that dangerous question. I'll just don protective gear before trying to answer it. I think, I mean, a lot of people say to me, so is the left hemisphere the male brain and the right hemisphere the female brain? And I think I know why they say that, because the right brain is big on empathy and is a more social brain. And certainly certain kinds of rather procedural thinking are more exaggerated in the left hemisphere. But I think, and here I'm treading on dangerous ground, but I think that what it is that, I mean, one of the things that people must, sorry, a little parenthesis here, but it's quite extraordinary how often people do brain studies without reporting lateralization. More and more they are, but they often didn't. And they're also not separating men and women, because we know that in these studies, men and women lateralize on all sorts of things completely differently. Oddly, they lateralize more towards, it tends to be more that the males use the right hemisphere where the women use the left hemisphere in almost all the examples that I know. But in any case, they need to be separated data. I think if you put it together with the fact that it's the right hemisphere that expands in relation to testosterone, and that probably the most uncontroversial male sort of skill is visuospatial skills, which are highly dependent on the right parietal cortex. It seems unlikely that one can just carve it up in that way. What my own theory is that there is a lot of evidence that there are fatter tails in the distribution of males than there are in females. So the normal distribution is flattened in male cases, which means that you get more duds at the bottom and more stars at the top. And it's not very obvious across most of the range, but when you deal with, you know, really extreme cases, then it becomes like 10 to 1. And I suspect that we therefore notice rather strange men who who are incredibly good at sort of some kind of logical calculation. But what we don't notice is that there are also highly gifted males for right hemisphere reasons, like maths and I mean, maths and analogical thinking, which all great mathematicians describe, not linear analytic thinking, but analogical thinking is very much a right hemisphere thing. And, you know, it just is a case that, you know, one can argue about social causes, but it does seem pretty robust that you know, there will probably always be a greater number of males in the top end of, say, maths. I think Larry Summers had to resign from Harvard for saying that, so I think I'd better stop talking now.
So, on that uncontroversial point, I think...
Can I make a correction, though? I think it's important in a scientific meeting. The Crespi model does not go along male-female bound.
The correct?
Yeah, the Crespi model,
oh, sorry, yeah.
does not go along the male-female bound as in Baron Cohen's model.
No.
It goes along the genetic imprinting of parental or maternal origin.
Right.
So just correction.
Thank you very much for that.
So thank you very much, Iain.